Should parents have their children vaccinated? Dr. Shukin?
Vaccines save lives and are the best way for parents to protect their children from
Good.
vaccine-preventable diseases.
Dr. Mithun, yes or no? Yes.
Yes, I have 3 children, and they were all vaccinated on time with all the recommended vaccines.
Dr. Robinson?
Absolutely.
And Dr. Fauci?
Definitely.
Dr. Fauci is Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases at the NIH. That was him testifying today in the House with other leading medical experts about this apparently newly controversial issues of vaccines that should never be controversial at all. Dr. Fauci is our nation's top expert on infectious diseases, and he joins us tonight for the interview. Dr. Fauci, thank you so much for taking time to be with us tonight.
Good to be with you.
So you obviously come at this not from a political perspective, but from a scientific perspective. I have to ask you if you are worried about the scientific and public health consequences of this becoming a politically controversial issue.
Well, I certainly hope that it doesn't, Rachel, because, I mean, this is something that is a scientific public health issue. We have this outbreak currently. This is not something we should take lightly. Measles can be a serious disease, and it's really unfortunate where you have a highly contagious infectious disease, a highly effective vaccine with really a very safe vaccine, and yet children are not being vaccinated. You know, it just does not make any sense, and it's not a trivial disease. I've heard people say, well, measles is you know, a relatively mild disease. You can have some serious complications, middle ear infections, pneumonia, encephalitis, and even death. So we can completely suppress it the way we did in this country. By 2000, there were essentially no measles cases in the country. And then with children not getting vaccinated, we're seeing the outbreak that we're going through right now.
I think because of ideological leanings and political constraints that derive therein, the argument that we are hearing now from some national leaders, or at least wannabe national leaders, is that vaccines are a good thing, but they ought to be voluntary. They're not for everybody, that each individual parent ought to make their own case, and the government shouldn't prescribe this. From a public health perspective, why is it important that these things shouldn't just be an individual family's individual decision?
Well, for 2 very important reasons. First of all, it's for the protection of the child, the individual child, but also we have a communal and societal responsibility to protect society. And when you do vaccines in which certain members of society, such as babies who are less than 12 months old, children who have underlying conditions like leukemia, people on chemotherapy who are suppressed, they can't get vaccinated. So in our mind, as a public health official and an infectious disease physician, I believe we have a responsibility to society to protect those children by making sure we don't have outbreaks. And you make sure by essentially vaccinating every child that can be vaccinated. That's pure, simple public health principles.
Dr. Fauci, there's obviously a segment of the population that thinks that they shouldn't get these vaccinations for their kids. I don't believe these folks are bad people, by and large, but their theories about vaccines are, as you say, turning out to be a really bad problem for public health in our country. What do you say to those folks? How do you explain it to people who are riven by fear about these things, even though their fears aren't scientifically grounded?
Well, what we try as best as we can is to get them the scientific and evidence-based information as to why the reason that they may have a problem with vaccine is not a valid reason. And, you know, one of the most glaring examples of that, Rachel, was that years ago, a claim that has been completely discredited that measles vaccine is associated with autism. And a lot of mothers, understandably, and fathers were frightened by that. Since then, it's been clear that that was fraudulent data that was completely discredited. Yet there's still that lingering feeling, unrealistically and not based on scientific data. So what we try to do is to try to make sure people, when they do make their individual decisions, they make it on real, solid scientific data. And hopefully when people do that, it'll be patently obvious that they really should vaccinate their children.
Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, our nation's leading expert on infectious diseases. Dr. Fauci, I know your time is very valuable. Thank you for being so clear and for being here tonight.
Good to be with you, Rachel.
Thanks. All right, we'll be right back. Stay with us.